Good evening, everyone, and welcome to tonight's webinar, a clinical presentation on skin rejuvenation and the effective treatment of melasma and pigment. Tonight's presentation will be on the Pastel laser system developed by Wantech. Next slide, please. Founded in 1999, Wantech has grown rapidly by specializing in laser and light-based aesthetic devices. This company has a diverse product lineup that includes surgical lasers, ultrasound, radio frequency, and home care devices. Through research and development, they have emerged as a leader in the aesthetic market industry. They continue to produce and manufacture the latest technology worldwide. Next slide, please. The Pastel laser system, which is an FDA-cleared device, is the latest in nanosecond technology and traditionally has been the workhorse laser system for total skin rejuvenation treatments, including pigmentation and tattoo removal. The Pastel laser is far superior in the market of Q-switch lasers. This laser system delivers energy at 1/1000th of a second using ultra-short bursts of energy in the nanosecond range and has the ability to transition into a long pulse laser and adjustable pulse duration. Using specific wavelengths of light, we are able to reach different depths in the skin and react to different types of target, such as ink, pigment, blood, and water. The high peak power and short pulse duration, this energy is delivered evenly throughout a spot size, causing targets in the skin to shatter molecules, reacting very quickly and delivering exceptional results. Next slide, please. Some of the special features of the Pastel laser include 4 wavelengths, including 1064, 532, 595, and 660. There is Genesis mode feature for non-ablative skin rejuvenation to deliver photothermal energy to rejuvenate the skin. PTP mode, which is twin beams of energy delivered at higher fluence with a period of cool down in between, which is ideal for conditions like melasma. The Pastel peel treatment using carbon cream, auto calibration for stable energy output, and automatic spot size recognition on the interface display screen. Next slide, please. The Pastel has a variety of hand pieces that allow you to toggle between the wavelengths and modes to perform a variety of treatments using both zoom and accessory hand pieces. Its top hat beam profile delivers consistent energy throughout treatments. Next slide, please. This laser has multiple applications and is user-friendly, a wide variety of energy settings, and offers the ability to provide skin rejuvenation treatments for all skin types. Next slide, please. Tonight's presenter will be Dr. Irene De La Peña. Dr. Irene is a certified dermatologist and talented medical aesthetic doctor in Bogota, Colombia. Her academic achievements and educational background include a medical doctorate degree at Havanera University in Bogota, Colombia, assistant professor and laser specialist educator at Rosario University. She is currently the medical director of Orbit Clinic and director of OCTA Professional Laser Training Program in Bogota, Colombia. Dr. Irene is also a member of the Colombian Society of Aesthetic Medicine. She is considered a mentor and a leader in the medical aesthetic industry. We welcome your questions at any time during this presentation. Please type them in the control panel of the GoToWebinar question box on the right of your screen. We will have about 10 to 15 minutes towards the end of this presentation to answer them. And if we are unable to answer any of your questions in the allotted time, we will follow up with you via email to answer them. So please sit back, relax, and enjoy tonight's presentation. And without further ado, I would like to introduce you to Dr. Irene to present.
Thank you, Carol, for that presentation. Thank you for the invitation for this webinar. I am really excited to share my experience with the Pastel device. As you all know, Colombia is one of the biggest aesthetic markets here in Latin America. I have tried a lot of devices, but one of my favorites is this one, and I am really excited to share this information with you all. So let's start. Let's start with pastel indications then. I'm going to talk about some tattoo removal and pigmentation treatments. I'm going to go deeper into melasma, and then I'm going to talk about acne and rosacea treatments and my protocol for rejuvenation. As Carl just said, this device has these two main wavelengths, 1064 and 532. As you can see in the graphic, both of them have really good affinity for melanin and also for oxyhemoglobin. This device has also the 660 and the 595 nanometers, which are really useful to treat some colored tattoos. And also with the 595, I can be able to treat some vascular lesions because of its closeness to the 577 peak of absorption of the oxyhemoglobin. In the tissue, we're going to have two types of effects. The first one is the photoacoustic effect, which is really useful for tattoo removal and pigmentary lesions. By the other side, we have the photothermic effect, which is really useful for acne, rosacea. And the combination of these two tissue effects is really good for rejuvenation protocols. Now continuing with tattoo removal, when we face one patient that wants to get rid of their tattoos, we need to classify it between amateur, professional, and traumatic. This is really important to determine how many sessions are we going to recommend to our patient to get through with their treatment. The photoacoustic effect is the way that this device permits the fragmentation of the pigment, and this allows the immunitary system of the patient to get rid of the fragments of the pigmentation. Our ending point is going to be the frosting, and this will show a really good chromophore interaction. We need to consider also the color theory when we're going to treat a colored tattoo. I have been able to treat almost all the colors with this device, except for two that are the most difficult ones, that is the light yellow and the white-based colors. I've seen two effects after the laser treatment with these two colors. The ink could stay the same, or it will get darker after the laser interaction, which is really good news because after that we can treat in the subsequent sessions. I consider it is a 50% situation, and this the patient should know before they start their treatments. Here we're going to describe the difference between a long pulse laser and a Q-switch laser. As you can see in the video, the long pulse uses a photothermal effect to transepidermally eliminate the pigment. And here we're going to see how the Q-switch works. The Q-switch, because of the shortness of the pulse duration, generates a shock reaction into the tissue and fragments the pigment. This, as I have said before, it's really important because after the laser treatment, these little tiny particles are going to be phagocyted by the immune system of the patient. This process will take almost 2 months, and this is why I recommend the sessions with the Q-switch lasers at least every 2 months. Here you can see a procedure video when you can hear the photoacoustic effect, and also you can see the frosting in the treated area. This is a before and after picture. As you can see, the frosting depends on the intensity of the pigment of the tattoo. And these are some before and after pictures of my patients. These are amateur tattoos, and you can see, for example, we got a really good result in a green amateur tattoo after only 2 sessions. And of course, with the 1064, we can treat amateur tattoos with really good results, as you can see here in this hand. In the professional tattoos, we're going to get longer because of the density of the pigmentation. And this is a result that I have got after 6 sessions every 2 months. For pigmentation treatment, we're going to use this device with the same exact mechanism of action for tattoo removal, but instead of using the 1064, we're going to use the 532 handpiece. With this, we can treat lentiges, age spots, freckles, and cafe au lait lesions. Here are some before and after pictures. You can see how a lentige can be get rid of after just one session. And here in the hands, you can see how after the crosses are gone, there is no pigmentary lesion under them. Here are then my protocols for tattoo removal and pigmentation. I wanted to let you know also that when the tattoos are accompanied with some skin elevation or scarring, like hypertrophic scars, I use in the same session fractionate laser. It could be a fractionate picosecond laser or a CO2. And the idea is to remodel that skin to get a better quality of skin after the tattoo is removed. Now let's delve into the melasma indication. Melasma is an irregular, unsymmetrical hyperpigmentation disorder in photoexposed areas like the face. It is considered also a photoaging disorder because its relationship with solar elastosis. We can classify it between dermal, epidermal, or mixed presentation, and also vascular and non-vascular melasma. This is really important to determine which protocol are we going to establish with each patient. It primarily affects phototypes 3 to 4, and most of the patients are women, but 8 to 10% are men. Genetics have an important role in its etiology because almost half of the patients have a relative with melasma. It is considered a treatment really challenging because especially of its high relapse rate and despite good results. Traditionally, melasma has been described as a disorder in the melanocytes. Hormones play an important role because it has been described melasma appearance in patients under contraceptives, finasteride, and of course in pregnancy. The hypermelanoses have been related to an increase in the presentation of receptors of estrogens and progesterone in the epidermis and dermis of these patients. Finally, inflammation and the sun exposure are really important in this etiology because collagen fibers and elastin transformation. There is an increase in vascularization also under the lesions of melasma. But the newest approach of melasma pathophysiology refers to the interaction with the surrounding cells and the melanocyte. Let's start with the keratinocyte. The keratinocyte is the one that receives the melanosome from the melanocyte. But when the keratinocyte is stimulated by the UVB radiation, it increases the pigmentation by the production of cytokines, hormones like the melanocyte-stimulating hormone, and melanogenic factors like beta-endorphin. Let's talk about the fibroblast. The fibroblast, after being stimulated by the UVA radiation and the short wavelengths of visible light, it increases its production of growth factors. For example, the POMC-derived peptides, which induce melanogenesis and melanocyte proliferation. Melasma lesions have an increase in vascularization. Endothelial cells produce endothelin-1 that is a powerful activator of melanogenesis. Phagocytes also influence melanogenesis by increasing pro-inflammatory agents like interleukin-1 and 6, and also could participate into the distribution of the melasma lesions on the face. Finally, the basal membrane is altered by the visible light and UVA radiation, allowing melanosomes to drop into the dermis. The whole interaction between the cells and the melanocyte increase its metabolism, and this is shown by an increase in its basal temperature from 72 degrees to 80 degrees. The objective of this device then is to reduce the melasma lesions by subcellular regeneration. So with this device, we're going to act and target the melanocyte, the fibroblast, the endothelial cell, and the sepocyte, reducing the temperature of the melanocyte from 80 to 72 degrees. Which modes are we going to use? The first one is the L toning, the second one is the PTP or photoacoustic twin pulse, and the third one is the Genesis mode. The Genesis mode is the 1064 mode with 300 microsecond pulse duration. This has two main purposes. The first one is vascular coarctation of blood vessels and also collagen and elastin regeneration. This is really useful for patients with melasma and solar elastosis. So here are the ideal modes to treat melasma pigmentation. Both of them deliver low power of a high affinity wavelength to melanin, in this case 1064. But here you can see the difference between both of them. The L-toning mode delivers the energy constantly with a 6 nanosecond pulse duration. By the other side, the PTP delivers the energy into 2 pulses with an interval of 100 microseconds, assuring a great accumulation of energy into the chromophore, in this case the melanosome, and maintaining safe the surrounding tissue. Here is how the PTP delivers its energy. For example, if we use affluence of 0.8 joules per square centimeter, the accumulation of energy into the chromophore is going to be 1.6 joules. But because of the 100 microsecond interval, temperature of the surrounding tissue stays low, preventing post-inflammatory hyperpigmentation. Now talking about L-toning, this reduces hyperpigmentation by subcellular photothermolysis. As you can see, the objective is energy accumulation, and we use a motion technique. The accumulation of energy accomplishes to do a dendritectomy of the melanocyte and the reduction of the number of melanosomes. As you can see in this slide, in the left side, prior to treatment, there is a high concentration of melanosomes and long dendrites. In the after picture, you can see a reduction in the melanosomes. They are almost gone, and the reduction of size of the dendrites. Here is a 3D representation of this dendritectomy. Diagnosis is mandatory and very important to recommend the treatment. I recommend dermatoscopy and devices like the Reveal to determine vascular or non-vascular melasma. Also, it's important to clarify if we have a dermal, epidermal, or mixed melasma, because that will give us an idea of how many sessions we will need with each patient. For example, epidermal melasma has a better prognosis than the dermal and mixed melasma. Prior to treatment, I always prepare my patients with a depigmenting agent and the use of sunscreen, at least for 20 days. If we have a case of vascular melasma, we should treat the vascular lesions before the pigmented lesions to assure good results. I would start with 4 sessions of Genesis or toning with the 595 handpiece, and then I would continue with PTP for 1 or 2 sessions every 15 to 20 days. And finally, I will do 3 sessions of toning every 30 days. For maintenance, I will recommend sessions every 6 months. For non-vascular melasma, we will start treating the pigmentation right away. I will start with PTP, then I will continue with L-toning every 15 to 20 days, and a final session of PTP. For maintenance, I recommend sessions every 6 months. These are some before and after pictures. This is a result after 10 sessions of PTP and L-toning. This patient had really good results after 6 sessions of L-toning and PTP. This is another patient that got a really nice result after 4 sessions of toning and PTP. And this is another patient that improved really well her pigmentation under the eye after 6 sessions of toning. Now let's talk about acne and rosacea. Let's recall acne pathophysiology. Acne is a skin disorder that occurs when hair follicles are clogged with oil or dead skin cells. It causes comedones that become infected, leading to pimples and an inflammatory reaction. The inflammation may cause a post-inflammatory hyperpigmentation. This is a video of the procedure with Pastel. This is the acne toning. I have found that the parameters from the device are really accurate, and I have had really good results with a reduction of the inflammatory reaction of the pimple stage of acne. Here are some before and after pictures. As you can see, before the patient was really carrying an inflammatory reaction. One day after, you can see a reduction of this inflammatory reaction. And after 6 sessions, the patient almost is cured. To talk about rosacea, we need to recall that in rosacea, there is an abnormal proliferation of blood vessels. In that way, we can use Genesis mode to look for vascular occlusion and also collagen remodeling. We can use toning with the 595, the 660, and the 1064 nanometer half pieces. These are my protocols, as I just said. The parameters are really similar to the ones that come with the device. Now let's talk finally about rejuvenation. The aging process includes intrinsic aging, which is genetically determined, and the extrinsic processes from environmental factors. There are changes in the dermis with fragmentation of collagen fibers and elastosis. Age spots, lentiges, and freckles become more noticeable. Opacity and pores are more evident, and wrinkles go deep. Here is a video that shows how Pastel will reduce age changes in the skin. It will stimulate the fibroblasts to remodel collagen and elastin fibers, reducing wrinkles, pores, and also, as we saw before, the blood vessels will be reduced and also the pigmentation. Here is the video of the Hollywood peel. This is a procedure that is really well sold in my clinic because we here combined the toning and the Genesis mode in the patient. As you can see, the changes are really significant and the quality of the skin improves a lot. So here are my protocols for rejuvenation. I usually combine every mode depending on the patient's characteristics and aging changes. I recommend the Hollywood peel every 2 weeks for 4 sessions, and I recommend Genesis and toning treatments depending on the patient's needs. Now to finish, I will talk about the adverse effects and complications. When treating epidermal lesions, the most common adverse effect I have had is petechia and persistent erythema, which I treat with topical steroids and ultrasound. When treating tattoo removal for color tattoo, it is important to consider the changes of color of the ink in the tattoo after the treatments. This is important to tell the patient prior the treatments. Finally, the most common side effect of toning technique is the appearance of acne lesions, which I treat with extraction and peelings. Thank you all for coming to this webinar. Now let's discuss. Do you have any questions?
So this concludes Dr. Irene's portion of the presentation, and we would like to thank her for her time and the information she has provided us today. So now it's time for some question and answer portion of today's presentation. And Dr. Irene, I'm just going to ask you some questions that are coming through. One is what are the pastel benefits of the laser therapy compared to other treatments offered nowadays?
Well, for me, there are three that are the most important. The first one is the short-term results, because patients um, they are used to just use some creams, and to get a result using just a topical treatment, you're going to get a long time. The difference here is that you will notice the difference at least 1 week after. So that's what I really love about this, especially in acne patients, that they have noticed a lot of a really big change in their face about their inflammatory reaction. The second one is that we are targeting more causes of melasma, for example, than with the traditional treatments. And also that with this device, the treatments don't have any downtime. So it is really good for just lunchtime treatment, and you can go back to your work, and you can continue with your life.
Okay, great, wonderful. The next question is, if I'm using an IPL in my practice, would something like the Pastel be a good tool to expand my offerings?
Oh, of course. It is really different. And as I showed in the videos, the mechanism of action is so different. And with the IPL, you will reduce the pigmentation through transepidermal elimination of the pigment. But for the acoustic effect is more effective for the dermal melasma, for example. And also the anti-inflammatory effect and the reduction of the vascular lesions are really important to complement your practice.
Okay, thank you. Um, is it possible to treat a tattoo that is covering a scar? And which treatment would you perform first?
Well, actually, I have a lot of patients with that, and I do two lasers in the same session. I start with the Q-switch laser, and then on top of it, I will finish with a fractionate laser. It could be a CO2 or a picosecond fractionate handpiece, and with that, I will try to remodel the lesion. So I have had really good results with this, and still I will do the sessions every 2 months.
Okay, thank you. Another question is, can laser genesis be performed on all skin types, especially Fitzpatrick skin type 6? Do you recommend using lower energy? What spot size do you recommend? And do you incorporate this with any other treatments at your practice?
Well, actually, yes, I have done it in some Fitzpatrick 6 patients, but they must be really prepared. With them, like usually with all my patients, I prepare them for 20 days, but with those patients, I would prefer to do some other treatments before. For example, 4 sessions of peelings to reduce the thickness of the skin. And also, they must be prepared with the pigmenting agent, so we can be like sure that there is not going to be post-inflammatory pigmentation. I do reduce the fluence, but not that much. I would definitely try to ask the patient how they are feeling the treatment, and I will try to just get a feedback with just a little bit of hot sensation, and I have had really really good results with that.
Okay, perfect. Thank you. Some other questions here. Can lasers be applied to the neck area and will it affect the thyroid?
Well, I have used them without any problem. Like the deep of the effect of the laser is not that um, aggressive to alter the thyroid.
Mhm.
I have treated acne lesions in the neck and also wrinkles and blood vessels, and I haven't had any complication. I will just do toning. And if I have to do some specific Q switch 532 lesions, like for example freckles or lentiges, I will try to do, if there are a lot, I will try to divide the sessions into more so I don't produce that many or that much inflammation.
Okay, perfect. Thank you. Another question is, can you clarify how you're achieving a photoacoustic effect using a Q switch? I know that you discussed this earlier in your presentation, but I just wanted you to expand on this a little bit more, if you can.
Can you repeat the question?
Yes. Can you clarify or explain how you are achieving a photoacoustic effect on a Q switch? Like essentially they're asking what does a photoacoustic effect mean?
Okay, so the photoacoustic effect is the interaction of the nanosecond pulse duration of the laser into the tissue. This pulse duration is so short that it really explodes um, and fragments the pigment into really tiny little pieces or fragments that
Mhm.
are going to be able to get rid of by the phagocytes from the immune system of the patient. So it is not only a thermal effect, it has a little thermal effect, but it is more a mechanic effect. It is like an explosion because of the shortness of the pulse duration.
Okay, perfect. Thank you. Another question here is, can you treat skin types 5 and 6 for tattoo removal with 1064 and 532? Is one
Definitely,
is one wave like essentially safer than the other?
yeah, definitely not 532. The risk for post-inflammatory hyperpigmentation or hypopigmentation is too high. I would definitely stay with 1064. I would have to prepare that skin a lot, and I would do a test spot to see the patient's reaction. I have had really good results with some patients, and I have had hypopigmentation with others. Still, with time, the hypopigmentation has resolved, but this is something that you need to discuss with your patients. And if they're willing to take the risk of the hypopigmentation where you're treating with lasers, especially the type 6 phototype patients.
Okay, perfect. Thank you. Another question here is, what is dual toning and where can it be used? I guess maybe just explain a little bit about L toning and PTP toning, especially when treating melasma. If you can kind of just talk a little bit about that again.
Well, actually, dual toning refers to using genesis and toning in the same session. So it is a really good combination for example, rejuvenation when the patient has, for example, freckles and lentiges in the skin, and also they have solar elastosis. So the combination of the two will reduce pigmentation and also stimulate collagen remodeling. So that is dual toning. So Genesis plus toning mode. About the difference between toning and PTP, the toning is a constant delivery of the energy with a pulse duration of 6 nanoseconds, and you will do it in a motion technique. The PTP is the division of that energy into two pulses with a gap of 100 microseconds between the two pulses. And this is ideal for melasma because if we recall the thermal relaxation time of the melanosome and the melanocyte is 50 nanoseconds. So here we're going with 20 nanoseconds. Then we have like a delay of 100 microseconds, and then another delivery of energy of another 20 nanoseconds. And that way, we're accumulating this energy into the melanosome, and we are conserving the temperature of the whole tissue surrounding these melanosomes. So, if we conserve the temperature, we are lowering the risk of hyperpigmentation after the treatments. So I really think the PTP is the best mode designed like for melasma, and I have noticed that in the results with my patients.
Okay. Great. Thank you for that information. Um, Another question coming in is it better to space out toning and PTP treatments every 2 weeks or 4 weeks? And do you recommend increasing a joule level at each treatment session?
Okay, so definitely for PTP, I will do every 15 days, like every 2 weeks. I will get longer time between sessions with toning. I don't recommend doing both of them in the same session. And according to that, you can just consider what type of melasma you're treating. If you're treating just an epidermal melasma, and you have treated already the vascular lesions, then you can start right away with PTP and finalize with the toning. If you are facing a dermal melasma, I would start with PTP but change right away to toning because it is more intense. And I have noticed a better results with the toning compared to PTP when we're treating the dermal melasma. So what I have seen is just you just need to try like how is the reaction. You should like see the changes after like 2 weeks of your session, and if it didn't work, maybe you can consider changing to the other mode. I don't agree about raising the joules every session because if you're getting the ending point, which is really light erythema, really light redness, it is okay to continue with the same fluence.
Okay, perfect. And is it safe to use in conjunction with your treatments to use Botox and fillers?
Oh
And
yeah,
if, okay,
yeah. Actually, well, you could do like, for example, a Genesis session and right away put some Botox and fillers. It is really like you can do it in the same session and they won't like interfere into one another.
okay, perfect. How long, here's another question I should have asked you a little bit earlier when we were discussing melasma, but how long do the maintenance sessions take in melasma? Or when would you recommend them coming back for a maintenance treatment?
Well, in my early stages with the device, I was trying to do some maintenance every 3 months, but then I noticed it is not necessary to do that. But it is not a good idea to wait longer than 6 months. So after I get my patient into the results that we wanted, I always tell them that they must come back every 6 months for a maintenance session. I will determine if I will do PTP or toning, but I would definitely tell them to come back every 6 months for maintenance.
Okay, perfect. Um, we're coming here at the end. I'm just going to ask just a couple more questions here. And have you seen good results in color tattoo ink?
Yes, really good. As I told in the presentation, I have treated most of the colors with really good results. I definitely start always with the 1064, and after the third session, I will determine the handpiece correctly to the color that I just got. The thing is, the colors of the tattoo change with the 1064. Usually they get darker, which is really good because then they will continue responding to the 1064. But if after the third session the red continues being really red, then of course I will start treating with the 532, for example. Now, according to the colors, the most difficult ones are, for example, the yellow, the light yellow, and the ones that have a white base, because there are two options. If you treat them with a 1064, they can get darker, which is really good because then they will respond in the next sessions. But some of them, like the ink, is so strong that they don't get the laser energy. So this is something that you need to tell like your patient if they're like willing to get the risk of erasing all the tattoo and leaving the white spots in the end, which has happened before. So that's my experience with color tattoos.
Okay, thank you. Another question here is, I find that a number of my patients desire a maintenance procedure to protect and improve their skin multiple times a year. Is this similar to RF microneedling or maybe a hydrofacial treatment? Is this a better option, would you suggest, or in your opinion?
Well, it is definitely less invasive than the microneedling. I love, for example, the Genesis mode because you get really good results with the quality of the skin without doing any intervention like with needles and things like that. But of course, you would need at least 4 sessions of Genesis to notice that change. It is definitely better than a hydrofacial. But I do have a lot of patients that are doing this regimen of taking care of their skin every month, for example, with Genesis, and it is really effective. And people love it because they do see the results, but they don't have any downtime and there is no pain at all. So that is really good. Also, compared to the microneedling, we are do treating pigmentation. So it is ideal for phototypes 1, 2 that are getting those freckles or sunspots because they're going to get an improvement of that compared to the microneedling because the microneedling is only stimulating per se the collagen and the elastin.
Okay, thank you, Dr. Irene. And then the last question here is there indications for treating a keloid scar, a hypertrophic scar, or any type of scar removal or improvement in patients that you've seen?
Well, I have treated a lot of post-surgical scars like C-sections and post-plastic surgery. Those the the scars that are still red or purple, they're really good and they respond really good to the 595 handpiece because of the interaction with the oxyhemoglobin. But of course, if you want to remodel the skin or to treat a hypertrophic scar, you definitely need a fractionated laser to combine with this 595 treatment.
Okay, thank you. So this concludes the question and answer portion. Now I actually would like to introduce you to Elijah Wheeler. He is VP of Brand Management of MD360 and a proud partner of Wantech USA. He is going to speak a little bit more about the Pastel and its benefits.
Hey, thank you so much for taking the time to meet with us today. I know your time is valuable. My name is Elijah Wheeler. I have the unique opportunity to be the VP of Brand Management for MD360, and we are proud partners of Wantech USA. Hey, before we wrap this up, guys, I know that each one of you is experiencing the pressure of limited time, demands in your practice, and the impact of COVID-19. Our entire team at MD360 and Wantech USA wants you to know that our thoughts and hearts are with you. For each one of you who serves on the front line, we at MD360 and Wantech USA thank you, as it's your hard work and dedication that promises our family safety and a better tomorrow. The presentation you just experienced is a brief introduction to one of the US's best kept secrets in the aesthetic marketplace. Internationally, it's been a different story. For over the last 22 years, Wantech has built a brand that's a household name, increased export numbers year after year, and has become a proven thought leader in innovation throughout the world with over 100 patents and 70 exclusive aesthetic technologies. To put this in a different light, Wantech is one of the 3 remaining companies worldwide whose engineers still reside in-house and has only increased its budget in R&D with a recent budget of over 42%. To give you an idea of this power in comparison with the rest of the market and US laser leaders, these companies have recently reported only an R&D budget of between 12 and 15%. This has become an industry standard. It's unfortunate and leaves you wondering if anything is really that different. For those of you who on this call who are fans of Wantech and already a part of the family, thank you so much. Here in the US, we're striving to replicate that same level of confidence and to build a community that you can be proud of and have been partnered with for over 22 years internationally. Here in the US, the next 12 months, you'll begin to see explosive growth from Wantech USA as we've just released 4 FDA cleared technologies that are first to market, the first being the Sandro Dual. This technology is the first hybrid wavelength driven platform that can treat a full man's back in under 20 minutes pain-free. Pastel, the only standalone Q-switched laser with a 4 wavelength platform with fractional settings at a fraction of the cost. PicoCare is the very first 3rd generation Pico technology with four wavelengths in a fractional setting. And then we have the V laser, an absolute gold standard vascular platform with a 532 and Tech 64 that can safely clear vascularity and pigment without pain. Not only will you experience industry altering technology, but a true ethical commitment to achieving your goals when deciding to adopt this aesthetic technology. As each of us know, this year has not been easy, and we take that to heart. So to ensure your success, you're not just buying a laser, you're acquiring a family committed to your success and the programs that we deliver results with. Consider this Wantech soft launch into the US market. Our desire is that you feel hopeful and will leave this event believing the aesthetic marketplace is real and to be treated with value. This is one of the only markets in the US economy that has not experienced any sort of drop, but has actually only grown. It's real, and when you seek to grow your practice or business, please consider Wantech. We care, and I promise you we're going to prove it. For those of you who are interested in further information into the Wantech product line and Pastel, expect an email from us after this presentation. Your local account manager will be happy to speak with you, help you achieve your dreams, walk through the steep path of an investment like this, and would love to share further about our technology. Thank you again for joining us tonight, and please finish this year strong. Be hopeful. The tide is turning.
All right, thank you so much, Elijah. Again, I just want to thank Dr. Irene, Wantech, Elijah, and everyone who attended tonight's webinar. We will have a recording of this and send this out at a later date. Thank you very much and have a great night.